Hi, this is Jen Rubin, editor-in-chief of The Contrarian. I am thrilled to have with us Larry Levitt, who is the executive vice president of health policy for the Kaiser Family Foundation, my go-to site for all things healthcare, all things having to do with public opinion about healthcare. Larry, it is a pleasure to have you.
Oh, pleasure to be here. Thanks.
So we have had monumental changes, at least changes in law that are going to affect virtually everyone who has really coverage in any manner or who doesn't have coverage. So let's kind of go category by category. What happens to people who are currently on Medicaid? What's going to change, and when is that going to change?
Yeah, I mean, some of the biggest changes coming are for people on Medicaid. And for those who don't understand Medicaid, this is the program for low-income people in our country. But it covers a broad swath of the population. I mean, it's low and frankly modest income kids, adults, people with disabilities, seniors who need nursing home care since Medicare doesn't cover long-term care. I mean, over 80 million people are covered in Medicaid. So in fact, it's bigger than Medicare and Social Security. So there are very big changes coming from the so-called One Big Beautiful Bill. Some of them will directly affect people, particularly those who were covered under the expansion in Medicaid under the Affordable Care Act or Obamacare. The biggest change will be work requirements for people covered through the ACA expansion. It's important to understand that most people on Medicaid are already working. Over 60% are already working. Most of those who aren't working would qualify for some kind of exemption under this work requirement because they're a parent, because they're too sick to work, because they're going to school. So it sounds like it wouldn't have much of an effect, but it would actually have a big effect because people would have to report their work or prove that they're eligible for an exemption, potentially every month. It would be up to states how often to do that. So the Congressional Budget Office estimates that millions of people, over 4 million people, would become uninsured because of this. Not because they're not working, but because they would fall through the cracks. They would get caught up in bureaucratic red tape. And we know that will happen because it happened in states that have done this, in Arkansas and Georgia.
Right.
There are other big changes coming in Medicaid, big cuts in how much states can raise to help pay for Medicaid through what are called provider taxes. These are taxes on hospitals and nursing homes that will shift costs to states. States have to balance their budgets. They have to find that money from somewhere, so that will lead to cuts. There are also big cuts in Medicaid and frankly Medicare and the Affordable Care Act as well, which we'll talk about, in eligibility for immigrants. And these are not undocumented immigrants. These are lawfully present immigrants, refugees, people under asylum who will no longer be eligible.
People under temporary legal status, for example, and
Exactly,
others.
exactly.
Now, one of the perverse incentives came as a result of a bargain that they were trying to enact in the Senate to get this monstrous thing through. And that has to do with the error rates. This bill was supposed to be about fraud and abuse and waste. But in fact, they put something in there that actually disproportionately rewards states that have high error rates. Can you explain that?
Yeah, no, it's a strange calculation in terms of penalties on states if you have but you're exempt if you have low error rates or actually if you have high error rates. And these I mean the Republican talking point for this bill has been it eliminates fraud, waste, and abuse. It doesn't cut Medicaid. But the truth is there is nothing, effectively nothing in this bill that actually goes after fraud in Medicaid. Fraud in Medicaid is primarily perpetrated by rogue healthcare providers who are billing for services that they don't actually provide. The error rate, has been framed as fraud, but it's really just, I mean, there are a bunch of reasons for why the error rate could be high. It could be high because, the documentation wasn't there for a payment to a doctor or a hospital. So yes, it's kind of bizarre calculation of how states are penalized, and that doesn't really even get at fraud, waste, and abuse.
Right. Now, one thing that is linked to Medicaid that we have heard over and over again is the fate of hospitals, particularly rural hospitals. That's because a large segment of their clientele, as well as urban hospitals, other ones, people who, uh, rather institutions that serve the poor, often these are teaching hospitals, are going to have less coverage. They're going to have less money coming in from Medicaid programs. How dire is the situation for hospitals and in particular rural hospitals?
Yeah, and the cuts to hospitals come in two ways. One is, as you said, because there would just be fewer people covered. The Congressional Budget Office estimates that 10 million fewer people would have health insurance as a result of this law. But also there would be cuts in payments to hospitals for providing care to Medicaid enrollees. And as you said, the cuts in hospitals would be across the board. It's not just rural hospitals; it's urban hospitals that serve low-income people as well. The reason rural hospitals are uh, disproportionately affected is just because their finances are shakier. I mean, many rural hospitals are operating on a thread. Many have closed. Many have shut down services. So the cuts would hit them harder, and almost certainly push more of them to close. There was a kind of provision put in the bill to get it through the Senate, a $50 billion slush fund for rural hospitals. It'll certainly make a difference, but the cuts to rural areas from Medicaid are more than double, almost triple, in fact, what that $50 billion fund would provide.
We're talking potentially dozens and dozens of hospitals closing. Is that right?
Absolutely, absolutely, and it's been happening already, and this will accelerate it.
Right. There have been studies that have looked at what happens when a hospital closes, not only to the people it serves, but to the economy of the region. Can you speak a little bit to that? These rural hospitals aren't just healthcare institutions. They're sometimes the major employer. They're kind of the backbone of many of these communities.
That's right. And what might precipitate a rural hospital to close is these Medicaid cuts. And obviously, people on Medicaid will lose coverage as a result of this law. But if a hospital closes, that means less healthcare access for everyone in the community. It means having to travel further for care, in some cases, not being able to get life-saving care because you can't get there in time. And you're right. I mean, in rural areas, these hospitals are often the biggest employer. There's a hospital in every single congressional district across the country. They did not have the kind of influence I think they've had in the past during this debate. But healthcare has been one of the engines of job growth, frankly, and that's especially true in these rural communities.
Absolutely. One last point before we move to other kinds of healthcare coverage. The implementation date of these Medicaid cuts are down the road, but hospitals have to plan ahead. So you're already beginning to hear about hospitals cutting back, hospitals warning that they're not going to survive. Can you explain the timing a little bit and when we're going to see the effect, even of future cuts show up?
Yeah, I mean, the cuts are very backloaded. Coincidentally, after the 2026 midterm election. I mean, even the work requirement, which is the biggest source of cuts, goes into effect, literally a couple months after the midterm election, in January 2027. But many of the other cuts, the cuts in provider taxes that states use to finance their programs, the cuts in supplemental payments to hospitals, those are all extremely backloaded. In fact, most of the cuts don't even hit until after 2030. On the one hand, that potentially provides some time for these cuts to be reversed. I mean, you've got people like Josh Hawley, senator from Missouri, who voted for this bill, but says he's now going to work to reverse the cuts. But if you're a hospital, particularly if you're a hospital operating on the edge, I mean, you have to assume these cuts are going to happen. I mean, if you're going out for a bond, to help finance your operations. If you're looking ahead to whether, you can even make a go of it. I mean, you can't just turn on a dime. I mean, those decisions happen years in advance. So, we're already seeing hospitals or clinics, saying they are closing or could close as a result. I mean, the truth is, just like after the Affordable Care Act passed, everything bad that happens in the healthcare system is going to be blamed on this bill. That won't always be true, but it will actually be true a lot of the time.
Absolutely. And we've heard from other healthcare experts that there will also be reductions in certain services that are frankly expensive, well care and other things that they will cut back on in anticipation of losing funding down the road.
Right. And,
So
in maternity care, I mean, almost half of births are covered by Medicaid, even more in rural areas. So maternity wards are going to have a really tough time with these Medicaid cuts.
So let's shift now to the Affordable Care Act, which we mentioned. It's not really in this bill, but the subsidies, the help that was passed during COVID to make it more affordable for people to buy in the exchanges, those potentially could go away. And if that happens, what's the result? How many people could be priced out of the market? And then what do they do then?
Yeah, I mean, this is a huge premium shock coming that it seems like members of Congress are just starting to
Yeah.
clue into. So, Democrats and President Biden during the pandemic passed legislation increasing the amount of financial assistance people get to help them pay their premiums under the Affordable Care Act. And it's substantial. I mean, people got on average $700 per person more in premium help. If these premium tax credits expire at the end of this year, as they're slated to do and aren't extended, people's out-of-pocket premiums would increase by an average of more than 75%. So a huge premium shock coming January 1st, 2026. And this will happen soon. This is not backloaded. Congressional Budget Office estimates that over 4 million people would end up uninsured because they simply couldn't afford to pay their premium anymore. And ironically, the biggest effect would come in red states, particularly red states in the South. These are states that haven't expanded Medicaid under the Affordable Care Act. The biggest enrollment growth has come in states won by President Trump. States like Florida, Texas, Mississippi. That's where the biggest effect would be. I mean, there's millions of people covered under Obamacare in Florida, and they would see big premium increases.
One of the benefits of Obamacare was the break it put on cost shifting. When people get sick and it's so severe because they haven't had preventive care, they go to the emergency room, and the emergency room has to treat them. These are the same hospitals that may be at risk anyway. And how do they make it up? They shift the costs to other programs, to other insurance. Is that going to happen if we have millions of people falling off of the exchanges? And also if we have people falling out of Medicaid?
Yeah, I mean, think about it. So the Congressional Budget Office estimates 10 million more people uninsured as a result of the so-called One Big Beautiful Bill. Another more than 4 million uninsured if these premium tax credits under the Affordable Care Act expire. Plus, the Trump administration just put out new regulations, which will make it harder to sign up for the ACA. That will lead more people to be uninsured. So we're looking at about 15 million more people uninsured. Those people still need health care, right? I mean, they will still end up in the emergency room. They'll still end up going to a hospital and being unable to pay their bill and going into medical debt. And in fact, the Trump administration just backed off a Biden rule that would keep medical debt off of people's credit reports. So it'll show up on their credit report as well. But hospitals have to get this money from somewhere. I mean, they will have to raise prices if they can to people with private insurance. So these cuts end up affecting everyone in some way.
Now talk about Medicare, which is obviously it used to be the third rail of politics, but the results of this are also going to ripple through Medicare. Talk a little bit about those. What's going to change down the road about Medicare and
Yeah,
Medicare financing?
yeah, there's a couple things. One is kind of modest changes in Medicare directly from this bill, particularly making certain lawfully present immigrants ineligible for Medicare. I mean, which would be the first reduction in Medicare eligibility ever, frankly. But the
Just to
bigger
stop
effects
there, these are people who paid into the system
yeah,
because the work and the way to qualify, you have to have been paid in for 10 years. So 10 years of payment and they don't get the benefit of that.
that's true. In fact, many undocumented immigrants pay into Medicare too because they're working, they're using someone else's social security number. But these are lawfully present immigrants who paid in, expected to get Medicare, and now won't. The bigger effects will be indirect. I mean, this bill would increase the deficit dramatically, and because of congressional budget rules, that increase in the deficit would trigger automatic cuts in Medicare, totaling about $500 billion. The Now in the past, when this has happened, Congress has overturned those automatic cuts, but this Congress has not been super functional, so who knows what would happen.
And how soon could that happen that we would trigger
That would happen
what they
quite
call the
quickly.
take-up?
No, yeah, that would happen effectively immediately at the end of the year.
So big picture here, this seems to have been a giant step backward from a transition we were making to cover more people with the notion that it's a bad idea to have uninsured people because they wind up in the emergency room, they get other people sick, they don't show up to work. And now we're stepping back from that. Give us a big picture of why that's a really bad thing, frankly, and what overall the economic impact of this could be.
Yeah, I mean, we, as a result of the Affordable Care Act and then the enhancements to the Affordable Care Act from the additional premium tax credits, uh, we pushed the uninsured rate down to the lowest level ever. I mean, we got tantalizingly close to universal coverage and certainly universal access to affordable coverage. We are now going backwards from that. And in fact, when you combine the effects of this tax and spending law and the expiration of the enhanced premium tax credits under the Affordable Care Act, we would erase about three-quarters of the gains in coverage from the ACA. So, unlike in 2017 when Republicans tried to repeal Obamacare and failed, they weren't talking about this as a repeal of the ACA or Obamacare, but it in fact is in its effect a partial repeal of the ACA. As you said, this has ripple effects throughout. It affects hospitals, as we've talked about. It affects prices that hospitals charge to people with insurance, and it affects people's access to care and their health. So it's and it will take. I mean, if these cuts go into effect, it could take a generation to then once again rebuild the healthcare system.
Every indication that the public doesn't like this. The polling that I've seen, Medicaid has never been more popular. You're seeing approval of 80%. 80% of the people probably don't approve of ice cream. I mean, we're talking astronomical numbers for political issues. Talk to us a little bit about public opinion. And, we saw the same thing under the ACA. When it looked like it was going to go away, approval went up. What have you seen in public opinion polling, and what would you expect if these cuts really do go into effect?
Yeah, no, and I mean the same thing did happen with the ACA in 2017 when
Right.
Republicans tried to repeal it and potentially replace it. I mean the ACA went from a program where the public was kind of mixed on it to quite popular, and that popularity has continued to grow. And in fact, it's more popular than ever right now. I mean, this bill, I mean, every single poll has shown that this bill is this law now is unpopular. And in fact, our polling shows the more people hear about it, the less popular it gets. And they are starting to hear more about it. It has made the Medicaid program popular. I mean, you would think that Medicaid would be sort of a third rail like Medicare, but it wasn't in this congressional debate. But it certainly is for the public. That what that means for the midterm election. Does this continue to be an issue? Can Democrats make it an issue since many of the cuts won't necessarily kick in? Democrats can point to things coming. They can certainly make the argument that if you put them in charge, they can stop it or reverse it. But yeah, I mean, the public there's no question the public is against these cuts, but that was not persuasive in this debate.
I suspect Democrats are going to make an issue. How successful it's going to be, we're going to find out. And I think we're going to get some indication when the lawmakers go back for their summer recess. This happened after the ACA. This happened when they tried to repeal the ACA. That summer after there are major healthcare changes, the public gets pretty loud. And we're going to see, I think, some reaction out there in the
Yeah, I
country.
suspect you're right.
Well, Larry, it is a pleasure having you. Folks, if you need data of any kind, or you just need a basic explainer, like who's covered by Medicaid, go to the Kaiser Family Foundation website, KFF. There's a wealth of information. It's what I rely on. Larry, thank you for joining us. We are going to come back to you probably again and again as we see this play out over the ensuing months and years. Thank you so much for joining us.
Oh, it's a pleasure. Thanks.